I just want to spend a little time this morning just doing a little bit of an overview of what I alluded to yesterday regarding the training program that we are in the process of developing. It came out a lot of it came out of last year's work. I mean, it's built on the work we've done over the last number of years, and last year, for those of you who were here, we did a bunch of work at the end of the symposium looking at what would be and how to deliver some of that content that many of you have been involved over many years helping develop. And with the generous support of the Robert Wood Johnson Foundation, we've been able to focus a little time this year on developing some material that will go into an eventual curriculum. So I just want to spend a couple minutes talking about what that is, because it's something that I think may help translate this complex work to help you, your organization, the people working in your organizations, and the broader community understand this. As a couple of the conversations I was having yesterday evening, bad news? Small problem with the video.
There's another video running. I need to take that.
Okay. Be my guest. Do we have can I have a separate mic? That'd be great. Pay no attention to the man behind the screen. Thanks. So, this way I can just go around and actually interview you all at the tables here. Good thing. Wake you all up here. So, what I was saying is that some of this material, I was having a conversation last night afterwards that really communicating this interoperability stuff, no less the interoptimability stuff, is a complex thing to do, as many of you experience in your work. Cross-sector, cross-silo stuff is hard, and it's particularly hard to communicate that sort of in a few bullet points or in an expedited way to an audience that may just be a health audience or a public health audience or a housing or whatever. So what we've tried to do is we try to create a way to think about this work and to understand it in a more expedited way, so we can get into that conversation more quickly as we go forward. So we offer that up as a way for this group and the extended group that's been involved to think about that. So I'm just going to say a few words, and then I'm going to say a few words, and then about the training curriculum. And then I'm going to ask Dr. Harold Lehman from Hopkins to talk a little bit about the work that they're doing now on informatics curriculum that we're hoping to be able to integrate into the work that we're doing as well, and give you a sense of where we're headed on that. And then maybe a few minutes for some overnight reflections. So in terms of the interoptimability training curriculum, the target audience for this is really, initially it's really sort of the executive leadership, program manager, supervisors, and at some point it moves into case management and people working actually delivering the work. The key goals of this really are to help manage organizational change. Again, thinking about a holistic, integrated kind of approach. How do you manage organizational change in this complex universe? How do you expedite responsible information sharing? And I use that word deliberately from the information sharing environment and Shemendra Paul's approach to the way they think about information sharing and the constructs that they've created at ISC. And we'll hear about a little bit more of that later, perhaps from Shemendra and from Steve Ambrosini, who's been involved with that work. Part of it is how to bridge those cylinders of excellence. We talk about program silos. So how do you actually do that? And what are the skills and approaches that are going to be useful to do that? And I think the most important thing is, how do you develop a new set of tools and knowledge and competencies to help that next generation, right? The people who are coming into the system now, think about the new set of skills. We're talking about agile development. We're talking about new technologies. We're talking about the ability to respond to crises very broadly. It's a different set of skills that people need, a different set of competencies. And so how do you create a mechanism for that? So what we have thought about in many ways is I'm using the word broadly, it's kind of this agile, customizable methodology, as opposed to saying, here's the curriculum, come get it. It is designed to be able to potentially respond to the needs that are out there in organizations as they look at their own maturity, so to speak, along the interoperability pathway. And there's some great models out there. I know that APHSA has really been developing some work around the human services value curve and trying to think about how do we dimensionalize and set out a methodology from very basic to very complicated. So this is an approach that builds on that. It also looks to build off of the 10-year experience, that more than 10-year experience we've accumulated from these symposium, regional symposia, research we've done, consulting work we've done, and also being able to draw on subject matter experts from whether or not it's Hopkins or Davis or Penn or other places that we've been able to work. So how do we bring the best minds into this work to be able to provide the best-in-class kind of academic and practitioner collaborations? And we're, as I said, in discussions with Johns Hopkins Bloomberg School of Public Health and Medicine about how do we bring some of that talent specifically to this audience in a consumable way. And also importantly, through the American Health Information Management Association, HEMA, we're in discussions about how to provide an accreditation. So from a vision perspective, much the same way that the industry has developed a PMP, right? Project management professional. If you want to do work in this area, how do you validate that you actually have the skills and experience knowledge to do that work? I don't know of interoperability, no less an interoptimability certification program. I mean, where do you go to get this stuff, right? Where do you send your people to go to get trained on this? I don't know the answer to that. When we were doing some work with Nick Machione in San Diego County and talking to him about this work, some of you may know Nick, and he's done, and their team has done an amazing job of bringing together, in a very large county, a very functional and a very productive way of really connecting across the dots in many ways. And we are having this conversation about how do you, how would you replicate this if you move to another county or if you move to federal or another state? How would you replicate it? And what he said was, we had to individually find people, train them, bring them in, and socialize them. And that took a long, long time. I would suggest that probably Mark Cherna in Allegheny has gone through the same thing. He's been there nearly 20 years. Uma, if she's here, she's been working for more than a decade to try to do that. And the question is, can you expedite that process in some way by validating a set of competencies and skills to say, you as employers could say, okay, somebody's been through this accredited course. We know that they have an understanding of these change drivers, of these competencies. We can bring them in and potentially increase the standard of practice by recognizing that there's, whether or not it's a MP, it's, from a professional degree perspective or from a certification perspective, that there's an opportunity to move the field forward, perhaps create a new labor category for people to hire into, and to create a new ethos around how do we do this work, recognizing the complexity of cross-system silo work. I'm sure if we talk to Sean in New Mexico or talk to folks in other states, that issue is probably front and center of how do you build a team with the competencies and the skills and the knowledge to be able to move that quickly forward. And so that's in a way, the approach. It's kind of a crowdsourcing, just-in-time, agile approach to bringing the skills, competencies, and tools and techniques to the field in a way that draws from the expertise from the larger body of folks. And so I just want to show you an overview. I don't know how many people have seen the video link of the training program. A couple people have. So this is just 2 minutes, so it's not the full 7 minutes. There are 3 videos in the series. The first one is up, kind of goes into some of the details of it. The other 2 are coming very shortly. This just gives you a sense of kind of how we're thinking about it, and here you go.
Stewards of Change Institute is proud to introduce its groundbreaking Interoptimability Training and Certification Program, or ITCC. Our vision, like yours, is to accelerate progress towards achieving health equity and better outcomes for communities across our country. The innovative ITCC program will offer training on demand through its state-of-the-art web-based platform and will enable your organization to prepare for the convergence of programs that span the HHS continuum, helping you build capacity to embrace the social determinants of health and wellness.
Thought leaders have long agreed that our national drive to optimize healthcare, while important, has been too narrow. Instead, the consensus among experts is that any truly effective healthcare system also needs to include other wellness-enhancing factors, such as access to quality education, employment opportunities, safe environments, and social supports. All of these elements fit under the umbrella term, social determinants of health and wellness.
ITCC uses knowledge and tools that were developed through our work over the past decade with thousands of HHS leaders, academic partners, and industry experts to prepare your workforce to achieve 21st century learning standards. This interactive curriculum is designed to teach you how to bridge program silos, expedite information sharing, and manage effective organizational change.
Click on Voices of Social Determinants of Health and Wellness to listen to national leaders discuss the vital role of social determinants.
At the heart of ITCC is interoptimability, a unique methodology that we created to build competencies that can meet the demands of an increasingly complex and interconnected field. Think of it as interoperability plus optimization equals interoptimability. Upon successful completion of the program, participants will receive accredited certification from the American Health Information Management Association, a global association that has provided training and certification for the health field since 1928. See how ITCC can help accelerate your readiness for change. Go to stewardsofchange.org to experience the new interoptimability training and certification program and make every worker your best worker.
So that's just kind of a quick overview of it. The other videos go into more detail about some of the policies that have transpired, some of the technologies that are available, and a whole bunch of other stuff that are available. So after that, those 3 videos, you should have a really good sense of the components of that. Hopefully it's something that resonates with you. And with that, I want to turn it over to Dr. Lehman to talk a little bit about the education and training program here. Thank you. Thank you, Carol.
You know, I wish our stuff was that pretty and sexy, but we're an academic operation, so you'll see a little bit about that. So I'm going to be focusing on a curriculum that we're developing along with the, well, I put the squiggle curriculum here in a second. The ONC had money during the HITECH Act for education and training, and then apparently there's some leftover money to clean it up. The original was 2010 to 2013, and ONC was actually very sensitive not to be giving a curriculum, but to be developing training materials that others could use as part of their training. And after where we are now is that there is new phase of developing training material, and it started out as health informatics in general, and then there was some specific interest in these 5 areas for this time around: population health, value-based care, new payment models, data analytics, and patient-centered care. I think all of them have a relationship to what everybody in this room is doing. Our chunk has been the population health, which I think overlaps the most with the human services. I will say in advance that the human services content is kind of small, although you'll see what the connections are. So we have this stellar faculty. I'm not on the list, so that's why I can say this. Hadi Karatzi is a relatively new faculty member in the School of Public Health. His face is bigger because he's doing most of the work. But Jonathan Weiner, who's been here, David Chen, Eric Ford, and Linda Dunbar. Just a conversation with Linda Dunbar as also a client, since she's a VP at the Johns Hopkins Healthcare, which is very involved in the community. And we asked her, who in your organization needs to know about population health? And she said, everybody from the registrar up to the CEO, because nobody knows what the heck this is all about. So when I saw Daniel's slide about starting from the top, I think we're a bit more of a bottom-up kind of operation. The material that will be available for free to everybody in this room and others is all this. I don't know if we'll read it all, but you can see that you'll see how it assorts in a second. So each one of these units is about an hour of material, and each unit includes a PowerPoint, transcript, voiceover. It's because it has to be 508 compliant, very not exciting looking things. And in fact, when we wanted it, we thought of putting it on Coursera. We were told, nah, it's not sexy enough. But the pieces are all available to you. And if you want a package, we can give you, each unit will be a unit that you can just plug into your own learning management system, or we can give you these 3 tracks. So we have an intro track, then the policy track, data, and interventions. And I can see any one of these being relevant to some of you in different capacities. The data track in particular tackles explicitly non-health data, and what are all the data sources available in the community, and how would you integrate them together? The Center for Population Health IT, from which Jonathan and Hadi co-direct, just had a retreat last week where these issues about how do you integrate these data from multiple sources was exactly their focus. Now, each one of us, there are about 7 groups doing this renewal of the training materials. We each need to train 1,000 people, so which is why I'm happy to give you these meals, because you train them, I get credit, we're all happy. So that's it. So, and did I tell you it was free? I just want to get that point across. We're already working with the VA, the state of Maryland. We got permission that public health people count as incumbent healthcare practitioners. So even though their original thinking was been like nurses in healthcare, I think everybody in your organizations would count. Then Hopkins Healthcare, as I mentioned, Virtual Health Systems, and Drexel. There's also 20 other units. I won't go into this. I think the slides will be made available. But of those that are being updated, I think networking and health information exchange is something that is being updated and is also available for you. Public health IT, usability, working in teams, planning, management, and leadership, and introduction to project management. And I think these are all at least material that would be useful to this community. If not, what we want to do is make our units kind of something that the ITCC curriculum would connect to, and maybe we could. I'm not sure that we can connect to it as well because of all the federal guidelines, but certainly y'all can link to our stuff. So there are other sources available online. For instance, ONC does have its own couple of units. OpenCourseWare has some units, but I think I'm hoping that the most important part of this talk is my email address, which is with 2 N's @jhmi.edu. Any questions? Did I mention that this was free? I just wanted to make that. Okay, good. Yes, sir. Good.
Harold, I understood it was free, but I'm wondering how does one access all of this? It sounds wonderful.
So there are two ways. If you want to get stuff this year, you contact one of the 7 folks. So if you contact me, we can get stuff to you directly. If you want to, by the end of next June, all 25 units in those a la carte pieces will be posted at ONC, so anybody can download and use the material for your own curriculum. So there is, if you want to modify, if you want to customize, if you want to integrate, there is that effort, which is not free, but that would be your effort. But so for sure, at the end, June 30th, 2017, look at the ONC website for all 25 chunks of material.